Hi folks, I'm Dr. Ed Beyer of Beyer Natural Health Solutions. Today we're going to talk about a really interesting topic because I've seen a lot of these cases over the years called gastroparesis. What is it? It's a delayed stomach emptying of food in the absence of any obstruction. So that the obstruction has to be ruled out. So what are the symptoms of gastroparesis? Well, obviously, if the food is not leaving the stomach quick enough, the acids that you have in the stomach, because the stomach, when it's healthy, is extremely acidic, the acids are going to get pushed up and you're going to have acid reflux or GERD. Nausea, vomiting, weight loss, because when the food doesn't leave the stomach, it doesn't get absorbed. Food gets absorbed not in the stomach, but in the small intestine. So these people start to lose weight, they have nutritional deficiencies. Obviously, they're going to be bloated, they're going to have gas, basically any GI complaint that you can have. Now, when the food sits there too long, then the acids start to erode away, creating ulcers in the lining of the stomach. And also, very important in digestive physiology, when the food leaves the stomach, the acidity triggers the gallbladder to dump bile acids and bile salts and triggers the pancreas. So you get poor gallbladder and pancreatic function, and so you get this downstream effect. So the bigger concerns with gastroparesis are, number one, it leads to malabsorption of nutrients, so nutritional deficiency. Folks, the organ in the body that requires the most nutrients is the brain. So we start to see things like brain decline, memory loss, anxiety, brain fog, depression, lack of motivation, all these neurological deficits. We start to see muscle wasting because the muscles aren't getting the nutrients. Bone starts to degenerate, and so osteoporosis is very common with this, and also fatigue. Now, it can cause in children certain neurological problems, things like the spectrum disorders, ADD, ADHD, Asperger's, and Autism. In adults, the neurological complaints that I've already mentioned, like memory loss, it increases the chances for Alzheimer's, Parkinson's, depression, mood swings, OCD, vestibular problems like vertigo and balance, movement disorders, tremors, and things like that. So the other bigger concern with gastroparesis, number two, is it leads to a breakdown of the gut barrier. So we have in our small bowel, we have this one cell layer lining that kind of acts like a screen door on your home in the summer. It keeps the bad things from getting into the bloodstream and keeps the bad things in the bowel where they can be removed. So when that gut barrier breaks down due to gastroparesis, we get these microscopic holes in that barrier system. And so things start to make their way into the circulation that don't belong, and the immune system starts to go after it. So that causes systemic inflammation. And when the immune system has to work overtime, it starts to make mistakes like attacking your own body, so it can lead to autoimmune disease. And it starts to attack foods that we eat that can lead to food sensitivity. So many of these patients are like, I can't even eat any food because I get these immune responses to them. So how is it diagnosed, okay? First of all, it's overdiagnosed. Doctors are calling gastroparesis when it's just simply another issue. The way to diagnose it is a gastric emptying test. It's a 4-hour test. So after 1 hour after eating, 90% of your food should still be in the stomach. After 2 hours, 60%, and after 4 hours, 10%. That's normal. So we can measure this. If it's not emptying quick enough, then they can make the diagnosis of gastroparesis. You have to rule out blockages with an upper GI study with barium or an endoscopy. So most doctors, like I said, give the diagnosis of gastroparesis when it is not. So there are basically, in the medical literature, there are two causes to gastroparesis. The first one is pretty easy to diagnose. It's a diabetic gastroparesis, where in diabetes, the peripheral nerves get destroyed, so you have a peripheral neuropathy, and the nerves don't work, so the stomach just gets lazy. The second one is the one that we see. It's called idiopathic gastroparesis. Now, the word idiopathic means we don't know, right? But we do know that this is a problem in the brain. The area of the brain that controls gastric emptying is not working like it should, and that's called the vagus nerve. So poor vagus nerve function controls swallowing, it controls stomach contraction, it controls acid production, blood flow to the gut, it controls the motility of our intestines, our gut immune system, it controls lots of things, gallbladder and pancreatic function. There are so many conditions where that nerve stops to work, and that's what we look at. And when we can get the vagus nerve to work, we get the person out of this gastroparesis situation. Now, the medical solution to idiopathic gastroparesis, the one that we see, are different medications like prokinetic drugs, erythromycin, Reglan is one that they use, antiemetic or throwing up drugs, or sometimes they even do Botox injections. These really don't work, folks. Now, the functional neurology and functional medicine, which is what I do in my clinic, Solutions to Idiopathic Gastroparesis, is we're going to look at that vagus nerve. We're going to look at vagus nerve function. And the way that we do that is I'm going to look at palatal elevation. When you open your mouth and you say, ah, 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 the palate should go up, right? And if it doesn't, we know that that vagus nerve is getting weak. We'll check gag reflexes. Folks, if you gag too easily or you don't gag at all, both of those are signs of the vagus nerve, because that's what controls the gag reflex, not working. We'll also listen to bowel sounds. When the vagus nerve isn't working, the bowel sounds will decrease. Folks, the vagus nerve is what controls our gut, and from a functional neurological perspective, that's what causes the idiopathic gastroparesis. Once we resolve that, then gastroparesis goes away. And traditional medicine and neurologists don't even look at that. So I have a handout. It's called the 32 Ways to Stimulate the Vagus Nerve Function. That's what I give to my patients to actually do these exercises at home. But we also have to identify and remove the gastric inflammation, things like food sensitivities, infections, leaky gut. We have to test and find out what you have there and remove them. And then we have to repair the damage created by the gastroparesis. So these are, you're going to be nutritional deficient. We got to measure for that. What do you need? You're going to have ulcers, so we got to fix that through natural methods. We got to correct the leaky gut. The microbiome's going to be all messed up, so we have to, correct that, and then we have to address the neurological impairments. If you like this information, please don't forget to subscribe for upcoming videos on digestive dysfunction and gastroparesis. Also, if you know someone that is suffering with this, please like and share this information. I'm Dr. Ed Beyer. Have a great rest of your day.